Medical coding terms. Get it right and you'll be a valuable asset in healthcare. Get it wrong, well, you can expect denied claims, compliance audits, and maybe even some career setbacks. Watch this video, beginners, so that you'll learn the essential medical coding terms. There are two types of excludes notes. You will see this when two conditions cannot be reported together. You will see this when two conditions can occur at the same time. Laterality refers to which side of the body that the condition or procedure occurs on. That could be left or right, which would be unilateral, or even both sides, which is bilateral. Default codes are found in the ICD-10-CM alphabetic index next to the main term. Code first is in regards to sequencing, where the underlying condition is coded before the manifestation is. In other words, it's the cause of the condition or the disease. Manifestation code will be the sign or symptom of the disease. It's not actually the disease itself. Typically, a code first note will appear next to this manifestation code that indicates the underlying condition must be coded first. A combination code is a single code that includes multiple conditions. An encounter could include a patient history, evaluation, testings, treatment, planning for treatments, exercises, education. There are different ways that an encounter could occur. So modifiers, they help to clarify procedures and services that would otherwise impact reimbursement. There are several types of modifiers. An example would be a modifier LT for the left side, modifier RT for the right side. There's modifier 51 for multiple procedures. A super bill is a list of services that's provided. It's pretty much a receipt and is typically used for out-of-network care. CPT codes are used to describe medical procedures and services. ICD-10-CM is a set of codes used by the provider to document patient diagnoses on medical claims as well as medical records, and it is based on the ICD-10 system. HCPCS is a set of codes for medical procedures, supplies, and services. DRG helps to monitor and improve quality of health care, and it also helps to classify hospitalized patients. It could be classified through age, secondary diagnosis, principal diagnosis, procedures, as well as gender. Medical necessity helps to ensure that healthcare resources are efficiently and effectively used, especially since many insurance companies will pay for only services that are deemed medically necessary. So bundling helps to prevent overpayment of services that are related. A parent code is a general standalone code, while the indented code under the parent code is known as the child code, and it has more information and details. An inclusive code is for specific services and procedures that are under one code. They're like bundled together because they're considered an integral part of the overall larger procedure, so they are not separately coded. An unlisted code is a code used when no specific CPT code is available to fully describe that procedure, and this is usually when there's new and experimental procedures and services. Most people are familiar with copay. It's just a fixed amount that a patient pays when they come in for a visit or a service. Insurance companies want to ensure that the coverage is appropriate and cost-effective and medically necessary, so they require prior authorizations for some services and medications before the provider can provide services. So CMS, they maintain and update the ICD-10 and HCPCS codes. They issue guidelines and resources, and they also monitor the medical coding practices. The factors that influences the RVU would be the physician work, the practice expenses, as well as professional liability insurance expenses. There are many reasons for a denial. It could be incorrect or outdated codes, missing modifiers, lack of medical necessity, documentation issues, patient eligibility issues. It could be duplicate claims, missing or incorrect information, and the list goes on. So for an appeal, you would need to understand and identify the reason for the denial, determine if it's missing any documents, any coding issues, inaccuracy, does it need a letter of medical necessity, correct all of those issues, turn in an appeal letter, and submit that appeal. So NCCI helps to promote correct medical coding and to prevent inappropriate payments, as well as ensure that the patients are receiving the right care at the right cost. This helps to deliver better patient care and operational efficiency and compliance amongst the providers. So under this model, instead of the physician being paid for a fee-for-fee service, which would be a fee for each service, they're paid under a set payment per patient that's enrolled in that healthcare plan. Acute is the sudden onset of a condition in a short duration, and typically an acute diagnosis is coded before the chronic diagnosis. A chronic condition typically has reoccurring symptoms and complications such as asthma and diabetes. But protects patient privacy and health data. A few examples would be the patient's name, their social security number, address, medical records, and date of birth. OIG does a lot, but as far as medical coding, they evaluate physician billing to ensure there's not overspending. They conduct audits, they develop compliance and monitor billing, and they also create educational materials. So an example of kickback would be anything of value that would be cash, credit, gift card, a gift, any type of soliciting or receiving offering to a patient in return for a referral, for them to purchase an item, or for them to purchase service. So during an audit, the auditor will examine the patient's records, the coding data, and billing information. They'll ensure the documentation supports the codes that were assigned. They'll pinpoint any, type of coding mistakes, any potential frauds, and they'll also correct you and educate you through training of policies. So I hope this video was helpful. One thing I want to stress, and I cannot stress it enough, is the importance of not only medical coding terminology, but medical terminology is very, very important. Like a medical coder not knowing medical terminology is like a GPS that doesn't know street names. Like what's going on? We can't. So you have to learn medical terminology in order to efficiently do your job and to feel good and not be stressed, because we can't have the stress either. Okay, so go check out my medical terminology playlist. I have a few videos up for that, and I'm looking to upload some more soon.